It gives me great pleasure to welcome you all to our annual conference for ward sisters, charge nurses and team leaders. Last year was the first year in which we held a conference for both ward sisters and charge nurses and team leaders. And we are delighted to once again, on behalf of the Chief Nursing Officer, to host your annual conference. This event provides you with a well-earned opportunity to network with your colleagues, to hear about innovations in practice, share best practice, and very importantly, reflect and make improvements, and most of all, recharge your batteries. You are the linchpins to ensure that high standards of person-centred care is delivered by your staff, whether that be in the hospital or in the community or in the patient's own home. The Executive Directors of Nursing want to wish you all the best for today. Olive MacLeod, Executive Director of Nursing with the Northern Trust, had planned and anticipated chairing this morning's session. Unfortunately, she and her Executive Director colleagues have had to attend a summit on emergency medicine chaired by the Permanent Secretary, Dr. McCormick, and indeed Charlotte McCardle, our Chief Nurse, and Minister are also required to attend that summit later today. So unfortunately, they will have to leave as soon as they have delivered their addresses. I'm delighted to see so many of you here today. We have almost 200 delegates, the majority of whom are ward sisters, charge nurses and team leaders. If any of you were at the Safety Forum's excellent Delivering Safer Care conference on the 12th and 13th of March, you will have seen pledge trees associated with the NHS Change Day. You may even have placed pledges on that tree. Today, NIPEC is fortunate that through Adam Dolby, one of the undergraduate medical students, we have been provided and been allowed to borrow the trees for you to add your pledge today as a leader of your team in your trust or in your organisation, and to make a pledge as to what you're going to do to make a positive contribution to person-centred practice. Remember, person-centred practice includes staff as well as patients. A blank pledge card is in your conference pack. Write your pledge and place it on the tree during the breaks. NIPEC staff will collect the pledges at the end of the day and add them to the pledge wall on the HSC Change Day website. The pledge trees are in the halls and over towards the top of the foyer at the top of the stairs. The aim of today's conference is to highlight the important role that our ward sisters and charge nurses and community nursing and midwifery team leaders play in shaping and delivering safe, effective and person-centred care. There will be some examples of resources developed by NIPEC in collaboration with its stakeholders, all of which have been designed to support and strengthen the pivotal role of community nursing and midwifery team leaders, ward sisters and charge nurses. The title of today's conference is Leading Care, Leading Teams, Innovative and Supporting Person-Centred Care. Our health and social care environment continues to provide us with challenges to try to find creative solutions in how we deliver our services. But our focus must crucially be on must be on providing it safely and in a person-centred way. The presentations throughout the day will give you an opportunity to hear about the excellent work being carried out across Northern Ireland under the themes of workforce planning and development, person-centred care, and the professional development of the workforce. A special welcome is extended to all our speakers, and in particular Professor Brendan McCormick, who's flown back from his new job at the Princess Margaret University in Edinburgh. A copy of today's programme and the available biographies of the speakers are in your conference packs, so you can read those at your leisure. All the speakers' presentations will be available to access on NIPEC's website after today. In your packs, you will also have the customary, much-loved NIPEC pencil and pen and trolley and gym locker coin. And this year we have included the once-only-use face mask to help you if you have to deliver CPR at any point. We also have some promotional material from NIPEC in the packs, including our resources and our many sites information. At coffee and lunchtime, I would encourage you to visit the excellent poster presentations from your colleagues and other stands in the room, including the Northern Ireland Safety Forum, HONI, 10,000 Voices, the Royal College of Nursing, the Royal College of Midwifery, and of course, NIPEC's own. Before we start, we have the usual housekeeping arrangements to advise you about. The toilets, in case any of you haven't found them just yet, are on the right at the top of the stairs on this floor. We have also been asked to bring to your attention that the King's Hall's evacuation procedure, in the event of an emergency, everyone should leave the building as quickly as possible through the emergency exits, which are clearly marked. They are located at the foot of the main staircase and in the Octagon and Abercorn suites on the first floor. Normally, an emergency will be brought to your attention either by an announcement over the PA system or by an alarm, which is a loud two-tone klaxon, or by the security staff. Depending on the circumstances of the emergency, the evacuation meeting point will either be at the front car park of the conference centre or the grassed enclosure at the rear of the conference centre. Security staff will be on hand at all times to advise and guide and direct you. I'm sure you're all aware that smoking is not permitted inside the building. Smoking apparently, however, is permitted outside, beside the smoking bins, but I'm sure that that many of you are not smokers, given all of the health messages that we now have and the role that we as nurses play in promoting health. I would also ask you to ensure that your mobile phones are placed on silent to avoid disruption to the speakers. Thank you very much.